మనం అన్మ్యూట్ చేసావా? టాపిక్ ఇది
టాపిక్ అన్మ్యూట్ చేయాలి. నీ ఫోన్ లో చూపించు. హలో, నీ ఫోన్ లో
ఇది వద్దులేమ్మా.
ఇంట్రడక్షన్.
అన్మ్యూట్ చేసావు కదా? గుడ్ మార్నింగ్ everybody.
Good morning, sir.
On
Good
behalf
morning,
of
sir.
the-
Good morning, sir.
On behalf of the DR.NTRUHS University of Health Sciences, this is the second WebEx meeting that we are conducting. This is a very useful topic. I thank all the principals of affiliated medical colleges and also dental, nursing and other specialties, because it is very, very important. As you know that we have to focus on the research. Yesterday we had a research committee meeting and we wanted to start postdoctoral fellowship even in a government institutions also. Some of the private institutions were giving. So yesterday we allocated 10 crores money for broad specialties and also super specialties postgraduates. So we have to encourage your students, particularly already the undergraduates were spending a lot of money, 70 lakhs like that. And for a teacher also we are giving 2 lakh rupees for the research work. So from now onwards, I think you can send the research proposals so that we will definitely fund from the university. The committee will be sitting once in a month. Are you listening or not? So we are doing these research activities. So today we have with us Ms. Natasha Gulati. So elsewhere health solution Gurukam, which has come all the way. And I think there are two topics: converting thesis into publication and research paper. How to write a research paper is also, this is very, very important, because some of the people, as you know, that they're in good in writing, but you should inculcate for every institute. So I request all the principals to start the research unit from the different colleges, so like government and also private, so that this has to be communicated to the university on regular basis. So definitely let us start beginning. I think the results will be seen after 1 or 2 years. So I request Dr. Sudha, R&D in charge, introduce the speaker. Thank you.
Good morning, one and all. Warm welcome to the today's session. Today's speaker is Ms. Natasha Gulati, from Asia on behalf of Elsevier Clinical Team. Yeah, she is working as customer success team manager, South and Southeast Asia, Elsevier Health. So I welcome Ms. Natasha.
Sir, excuse me,
Everyone,
voice is,
sincere
sir, good
thanks
morning,
to
sir. It's not clear, sir.
for allowing us to organize this session. Sincere thank you to Dr. Sudha as well for her support and to the entire NTR community for supporting Elsevier. It is our pleasure to be here today. My name is Natasha. I'm the Customer Success Team Manager for South and Southeast Asia. I'm based in Malaysia and I work across the APAC region. We have dedicated health research development program, and the purpose of this program is to support researchers to improve the quality and efficiency of their publication output, their research and publication output. So we have a session on converting the thesis into a manuscript. We will be taking about 1.5 hours for this session. Maybe we can switch to the slides. Thank you. Slideshow mode. All right, so let's start. Today we will be talking about converting your thesis into a manuscript. As I was mentioning, we will take about 1 hour plus. So we have time till 1:30. We will try to spend about 1 hour plus on the presentation. Because of logistic constraints, we request that we have the Q&A at the end of the presentation. You can put your questions in the chat, or you can just write down your questions and we will discuss at the end of the session. Or we will also share our contact details. So if anybody wants to email us for further conversations, we are very happy to support. I also have with me my colleague Durga and Kishore, who are based here, very close to Vijayawada in Hyderabad. So if you have any follow-up requests, Durga and Kishore will be happy to support you. So today we will do some context setting to get started, and then we will go through the important steps that you need to follow as you move from completing your thesis to the manuscript writing and submission. So first and foremost, completing your thesis. A big congratulations to everybody who has completed their thesis. Big round of applause to all of you. This is not an easy task. Completing your thesis is very, very arduous. It takes a lot of time, takes a lot of effort, and it is a big milestone in your career as a researcher. So a big congratulations for those who have completed your thesis. Now, once you have completed your thesis and you are considering publication, our advice is to take a break first. So take a pause. Reason being that when you have completed your thesis, you're very proud. It's a very proud moment. You feel very strongly about your subject area. Take a step back and try to reflect. Talk to people. Understand what is happening outside your institution. And ask yourself these questions. Is my research new and novel and relevant? There are many, many instances where we actually do a thesis, but the subject area is actually not new and novel or relevant. We have to talk to other KOLs, we have to talk to other researchers, colleagues, supervisors, mentors to really confirm and understand whether my research topic and my findings are new, novel, and relevant. On the same note, are my findings significant? Is it significant enough to be shared with the entire world? If it is significant enough to be shared with the entire world, is it only one significant finding? Or have I been able to capture 2 to 3 multiple significant findings? Because if my thesis, and that happens a lot of times, if the thesis has generated 2 to 3 multiple significant findings, then you should break down your thesis into 2 to 3 articles rather than trying to write one big article. Many times a thesis can actually generate 2 to 3 articles in a lot of instances. And also think about who will be most impacted. Sorry. Who will be most impacted by my research? Is my research relevant to patients? Is my research relevant to healthcare providers? Is my research relevant to medical education community? And at the same time, will they be the reader? A lot of times we do research that impacts patients, but the readers of that research are actually clinicians. Or we do research that impacts students, but the readers of that research are actually faculty members. So think about who is actually being impacted versus who is actually being the reader of your research. Why are these questions important? Let me demonstrate that with an example. In the publishing community, we receive hundreds and thousands of manuscripts every day. And so many times we reject many manuscripts. And still, if you look at the body of literature which is published, especially when you start looking at the body of literature which is published in open access or low quality journals, you will find that a lot of research is actually not adding value to the clinical community. So here's an example. This is a published article which talks about the level of wastage in research we have seen in, for example, lung cancer. So these authors, Perrine et al., they found that within the scope of lung cancer, there were 77 trials covering 28,000 patients. And on those 77 trials, about 29 systematic reviews had been written. However, when people analyzed all of that research data and spoke to clinicians who were trying to create a treatment plan for lung cancer, the data was not enough. So much research has been done. All of this research, a lot of it could possibly be coming from thesis, from PhD projects, but many of it does not actually contribute to healthcare. And that becomes a challenge. That's why you should ask yourself the question, is my research new, novel, and relevant? Once you have established that, yes, my research is new, novel, and relevant, and I am ready to start converting my thesis into a manuscript, the first thing you need to do is identify a suitable journal. Now, identifying a suitable journal itself is a process. And here we have some parameters that you can use to support you in that journal identification. So on this slide, I'm sorry that panel is covering the first point, but on this slide, basically you have 6 parameters that you can use to identify a suitable journal. The parameters marked in dark color are quantitative parameters, and the parameters marked in light color are qualitative parameters. So in the quantitative parameters, we have things like journal metrics, timelines, as well as publishing model. In the qualitative parameters, we have alignment with the journal aim and scope, the target audience of the journal, as well as make sure that the journal is not predatory in nature. We will discuss these parameters in detail because if you have completed your thesis, you need to identify your journal before you can move into manuscript writing. So let's talk about these steps in detail. The number one of the top reasons for manuscript rejection is actually misalignment with journal aim and scope. So for those of you who have published before or who understand the publication process, every journal has a very well-defined aim and scope. And that aim and scope will be clearly stated on the journal website as well as in the journal guide for authors. So every good journal and index journal has a very clear guide for authors, which gives very clear recommendations, very clear guidelines on how you have to write your manuscript. That is why we have to identify the journal first, so that from day one of the writing process, we follow the journal guidelines and we align with the journal aim and scope. So a journal aim and scope looks something like this. So this is the journal aim and scope for Lancet Infectious Diseases. If you go on the website, this is the first thing you will see. The aim and scope talks about what is the journal all about, what is the major issue, what is the scientific question or knowledge gap that journal is trying to fulfill. So in this case, we can see Lancet Infectious Diseases. They have given in one paragraph a long list of different types of infectious diseases: bacterial, fungal, parasitic, emerging infectious diseases, HIV, AIDS, malaria, tuberculosis, many other types. And they have also given broad parameters like neglected tropical diseases, travel medicine, which covers a very broad scope. Now, in this broad scope, if your research is something related to metabolic diseases, or if your research is related to population health, it may or may not align with the aim and scope. Population health, maybe to some extent, but metabolic diseases, probably not. So if your thesis, if your research is within these parameters, then it makes sense to target Lancet Infectious Diseases. Also, in terms of the scope, many journals have clear definitions of what type of research they can publish and who is their target audience. So in this case, you can see that the Lancet publishes articles, reviews, historical reviews, personal views, and some other types. It does not publish case reports. Similarly, there could be other journals that only publish original articles. They don't publish reviews like systematic reviews and meta-analysis. So if your research was on an original article and you submit it to the correct journal, it will get accepted. But if you have done a systematic review and the journal does not accept systematic reviews, then that's a very direct reason for rejection. And trust me, a lot of manuscripts get rejected because they are targeting the wrong type of study. Sometimes the journal says that we only write interventional studies, but the writer has actually done a cohort study. So a cohort study for some might be an interventional study, but for this journal, it does not come under that purview. That can be a reason for rejection. So there are these little nuances which you might not be aware of. That's why our recommendation, if you are interested in a journal, besides reading the aim and scope on the website, you must also go to the journal. You have access to Clinical Key. In Clinical Key, you get access to over 900 journals in full text. So go to the journal, read at least the last 2 to 3 issues of that journal. Read the full text articles in that journal. Sometimes within the aim and scope also, the journals may be focusing on something. For example, a neuroscience journal is focusing only on Alzheimer's disease because 2025 is the year of Alzheimer's by WHO. So if your research is related to Alzheimer's, the chances of getting accepted by that journal are much higher. Sometimes journals have special issues. So there are certain journals which are related to, say, medical education, but at a certain time of the year, they publish conference proceedings in medical education. So if your research is related to conference proceedings or something that an intervention that was conducted at a conference, the chances of getting published in that special issue are much higher. So even within the aim and scope, don't limit yourself to only what is written on the journal website. Go to the journal, read the full text articles for the last 2 to 3 months or the last 2 to 3 issues, and then decide whether your manuscript falls within the journal aim and scope. This is a very major reason for rejection. That's why a lot of journals themselves publish articles on why they are rejecting many manuscripts and why the manuscript is not aligning with their aim and scope. So even many journals publish articles clarifying the aim and scope in a lot of detail. And again, we encourage you to read that background on Clinical Key or any other source before you confirm which is the journal that I want to publish in. So that's a very major decision that you have to take, which journal that you want to publish in, because you're at that step. You're at that stage that, okay, my research is done, my research has been collected, data is ready. Now, before you start writing your manuscript, that it's very important. I need to have the right guidelines. So I need to know which journal I'm writing for. Besides the aim and scope, like I said, there are 5 other parameters. Very much related to journal aim and scope is the journal target audience. Going back to what I mentioned, besides understanding what your research is all about, is it about patients, is it about students, is it about providers, who is going to read your research? So I'll share this with an example. In Singapore, I work very closely with Singapore researchers. In Singapore, nobody cares about getting published in the Lancet. Nobody cares about getting published in high impact journals. In Singapore, they have a very strong culture that the research that is being done in Singaporean patients should be read by Singaporean doctors so that Singaporean doctors can apply the research in practice. So for them, the most prestigious thing is to get published in Singapore Medical Journal. So they have a very different mindset. They don't care about international journals. They care about being published in Singapore Medical Journal because they are writing research for Singaporean doctors to read. Similarly, if you are writing research for anesthesiologists to read, you should focus on getting published in an anesthesiology journal. Many anesthesiology journals will not have a high impact factor because it's focusing on a very niche specialty. Neuroscience is a very niche specialty. Not many people read it. If not many people read it, it doesn't get a lot of citations. So it doesn't have a very high impact factor like 10. Maybe it will have an impact factor of 2 or 3. But for an anesthesiology researcher, that is where you should be focusing on because that's your target audience. So that matters. And the third qualitative factor is to be aware of predatory journals. We'll talk about the predatory journals in a bit more detail. Let's quickly also look at the quantitative metrics. So in the quantitative metrics, the first and most important thing, impact factor. Impact factor is a metric from Web of Science. A similar metric from Elsevier is site score. So it's up to you which metric you want to choose. If your research is in a very, very niche area, very, very specialized area, you should also look at SNP, which is an industry weighted, field weighted citation, right? So you should look at the field weighted citation rate also. It's up to you which metric you choose. It's also up to your institution. So many times NTR as an organization or the college that you belong to will have guidelines that we will approve funding only if your target impact factor is above 4. And it's fine for the institution to have these kind of guidelines. So discuss with your institution also on what is your expected citation rate. The second part is about timelines. Getting your research published itself can take up to 6 months, sometimes almost up to a year. I will tell from personal experience. I wrote a very, very simple research in nursing based on one of our solutions, clinical e-learning. I wrote a very simple research with a customer in Vietnam. And we wanted to actually target Indian Journal of Nursing because we thought it would be a good journal to target from an audience perspective. We submitted the manuscript in December. We got the acceptance in April. And the manuscript actually got published in September. So it can take that long, 9 months for your article to get published. The higher impact factor, the longer it takes for the journal to do the peer reviews. So if you are in a hurry to get published, choose a journal which balances the impact factor. If you have time, if you're an experienced researcher and you don't have to worry about timelines, if you have some bandwidth, then you can target the longer journals, the journals that take longer time to review. But it is important. So if you go to a journal finder, we'll share about journal finders.
Only materials, only.
If you okay, if you go to a journal finder, the journal finder will mention.
Separate.
All of the participants mute yourself, please.
సేవలు అడుగుతున్నప్పుడు
ఉంచేటట్లేదు సార్ ఇక్కడ
దాంట్లో ఎందుకు చేయమని చాలా సార్లు లెటర్లు పెట్టారు
సార్ నేనేమో మిమ్మల్ని
Sir, good afternoon, sir. There is lot of
journal website, as well as if you go to a journal finder, we share about journal finder also. They all state that how long it takes for the journal to give you the first decision, which is whether your manuscript has been accepted for peer review or not, and how long it should take for the journal to publish. So these details are actually given on the journal website. We also receive many requests where the website says that the journal will take 6 months to publish, but my manuscript has been sitting in review for 9 months. Can you help? If you are having that challenge, please, especially with an Elsevier journal, please reach out to our team and we will check for you why your manuscript is taking longer than normal to publish. So be aware of the timelines. And the fourth quantitative metric is publishing model. I will combine the data on publishing model with predatory journals. So why is predatory journals such an issue? Can you click on the slide, please? Thank you. This is the Elsevier Journal Finder. It's a free tool. You can actually click on the link at the bottom. And then when you go to the Journal Finder, you can actually put your title and some keywords or your abstract. And the system will recommend Elsevier journals that align with your aim and scope. And also on this, you will get a list of journals with their publishing timelines, APCs, all those details. If you don't want to publish with Elsevier, you can actually go to another free tool called Jane. In Jane, it covers all other publishers, not just Elsevier. So same process. You can put your title and abstract into this platform, and the platform will recommend journals that match your research aim and scope. So this is step one. But at the same time, we also have to avoid predatory journals, especially for those researchers who are trying to get published for the first time. Those people who have just written their first thesis and are now at the stage of completing their first thesis and getting it published into a manuscript, they are the ones who are at the highest risk of getting attacked, literally attacked by a predatory journal. So this is the problem with predatory journals. Predatory journals follow a business model called open access publishing. In open access publishing, the idea is that the reader should not pay for reading the research. The reader should be able to access research at free or minimal cost so that science can progress. That's open science. The cost of publishing has to be borne by the author and the publisher. That's why we have things like hybrid models, open access models, or gold access models, where either the author bears the entire cost of publishing or the author has some embargoes and we share the cost of publishing with the publisher. As opposed to this, we have the subscription model where the cost of publishing is not borne by the author. The author doesn't have to pay to get published, but the reader has to pay to read the article. So predatory journals are actually using open access publishing, but they are abusing the process. Most high impact journals, including the Lancet, now have a hybrid model where you can submit in open access. Lancet will still do the same level of peer reviews. They will still do minimum 3 up to maybe even 10 peer reviews, even if you are publishing in open access. Predatory journals, on the other hand, don't do that level of quality review. They don't do good peer reviews. They basically target young researchers who are in a hurry to get published by just accepting your manuscript and quickly getting it published, maybe within 1 week or 1 month. Within 1 week or 1 month, you get an email saying your manuscript has been accepted. So they have not spent the time and effort to do the level of good quality reviews. The result is that, yes, your manuscript will get published. By right, you're published. But because it is a bad quality journal, instead of getting you respect and reputation, it actually gets you shame in some ways. Even if it doesn't get you shame, because it's a bad quality journal, people will not read your article. When they don't read your article, you will not get citations, and that will not help your research career. If you want your research career to progress, you have to publish in good quality journals. So we really request young authors who are just writing their thesis and trying to publish for the first time, to be very careful not to publish with predatory journals, because it will not be beneficial to you. It will not be beneficial to the scientific community. And some of the things that you can do to identify predatory journals are listed on this slide. So some of the things I will just quickly summarize this to explain. Most good quality journals will ask you to pay only after your manuscript has been accepted for publication. If a journal is asking you to pay even before the review process, if a journal is asking you to pay as soon as you submit, question whether it's a predatory journal or not. Question the timelines. If a journal is able to review and accept your manuscript in just 1 week or 1 month, chances are that it's a predatory journal. About 2 to 3 months is a good timeline. If they are taking 2 to 3 months, then it's fine. But if somebody is giving you the decision to publish very fast, question whether they have done the right reviews or not. Go to the journal website. Many predatory journals have fake journal website, or on the journal website, there will be many articles published, but those articles are coming from the same 2 to 3 authors. Many articles will be published, but when you read the article, the quality of language is bad, printing quality is bad, there are spelling mistakes, there are typos in those articles, all those issues will be there. And last but not the least, if you are still not sure, if it is an Elsevier journal, you can write to our team. We will do the QC, we will do the checks on your behalf. If it is a non-Elsevier journal, but you still want to confirm, you can always write to the editorial board or the chief editor. So again, a good journal will mention the names of the editorial board and the contact details of the chief editor on their website. You have all the right to write to the chief editor, ask them what is your business model, who's bearing the cost of publication, and they will respond. If you don't get an answer and it's an Elsevier journal, please write to us. We will support you in verifying. But be very careful, especially those of you who are writing your manuscript for the first time. Be very careful about predatory journalism. Now let's assume you have, one more point on that. Another tool that you can use to check whether it's a predatory journal or not is this website. It's again a free website. On this website, you actually have a checklist that helps you evaluate whether a journal is a predatory journal or not. So you go through this checklist, you check whether the journal meets all the requirements on this website or not. And only then, once it meets the requirement, then you can submit your manuscript. Then you can confirm that it's a valid journal. So this is also a useful tool that you can use. We will be sharing these slides with everybody. So all the slides, all the links and the additional material, everybody will have access to it. So now let's move forward. Let's assume, using the framework that we shared earlier, you have identified which journal you want to target. Now we come to the point about framing your manuscript. Now, when you have to start writing your manuscript, the number one mistake or the number one misunderstanding that we see is that, oh, my thesis was so long, my thesis was 200 pages, this article is only 10 pages, all I have to do is cut, copy, paste. That is the biggest mistake that you can make. Sorry, this one. Please, please, please do not take the shortcut of cutting, copying, pasting, or rewriting your, or rephrasing, paraphrasing your thesis. It will actually take you longer to do this. It will actually take you less time if you start your manuscript from scratch. It's kind of like additive printing versus copy pasting, the copy printing. If you build from bottom up, you can always bring in elements from your thesis. But if you take your big thesis, 200 pages, and then start cutting it down to 15 pages, it will take you much longer. And there are a few reasons, few other academic reasons why you should not cut, copy, paste from your manuscript. Allow me to share here. There are some fundamental differences between a thesis and a journal article. First of all, the purpose. The purpose of a thesis is academic. We write the thesis that for academic purposes to demonstrate that we have understood our subject area. We have become specialists in our domain and we are ready to now start operating, start going into the workforce as that specialist. The purpose of a journal article is totally different. The purpose of a journal article is to fuel scientific curiosity. It may or may not have any academic inclination at all. It is almost like the difference between a book, a Harry Potter book versus a Harry Potter movie. They are serving two very different audiences. The book is for readers, the movie is for children and adults who want to have some fun, right? So the purpose of the thesis and the journal article is very different. And now if we look at it section by section, the thesis consists of chapters which are lengthy. Again, those chapters have a lot of academic detail and therefore they have a lot of words. There is no word limit. The journal article has sections, not chapters. It has very small sections and there are very strict word limits in a journal article that we must adhere to. Every section will not have a word limit, but the total article has a word limit and we have to do justice to that word limit. We'll talk about that in more detail. The thesis has to go through IRB approval. And the biggest difference is that IRB is in your institution, whereas the journal has to go through a peer review. And that peer reviewer is not coming from your institution. Sometimes that peer reviewer is not even coming from the same field as you. So again, the approval process, the people who are actually reviewing that output is very, very different. So that's also very fundamental different. In a thesis, you present everything, whether it's a relevant finding, irrelevant finding, correct result, bad result, good result, whatever it is. In a thesis, you present every single data point. In an article, you must be selective. We'll talk about selection in the method section. We talk about selections in the results section. You have to be very, very selective of what you're including in your journal article. So that's why cutting, copying, pasting is not the best idea, because fundamentally a thesis and a journal article are very different. So we request that you try to start from scratch. And when you're starting from scratch, here's a good framework to begin with. So this is again a guideline. It is not a necessity, but this is a recommendation on how much time, effort, and word limit or space you should spend on every section of your manuscript. In your manuscript, the most important sections are the results and the discussion. So maximum time, effort, and space should be reserved for the results and the discussion. The introduction, as opposed to the introduction of a thesis, is actually the shortest portion of your manuscript. In a thesis, the introduction is very, very long. Whereas in a manuscript, the introduction is one of the shortest and most concise sections. The methodology literally depends on your methodology. It can be short, it can be long, it depends on your methodology. So we'll go into the details of each of these sections. We'll actually start with results, tables, and figures. As I mentioned, the most important section of your manuscript is your results and your discussion, and your results include your data tables. So for sake of efficiency, it will be most efficient for you to start with the results, tables, and figures. That is also the section where you have the maximum guidance in the guide for authors as well as in global frameworks to help you write these sections. So for example, if I look at the guide for authors, the guide for authors gives very clear guidelines on what should be the formatting, what should be the font size, whether you can use bold, whether you can use italics, whether you should call your tables as 3.1, 3.2 or not, or should you just say table A, table B. All of that guideline is given in the guide for authors. So it is very easy for you to start formatting your manuscript from this point. Because it is easy for you to start formatting your manuscript from this point, it helps you overcome that inertia. Imagine an author who's trying to write a manuscript for the first time. They're sitting, they're scared. They don't know how to move. It is literally inertia that doesn't let you start. But when you have all the guidelines on how to format your tables, it helps you get over that inertia and it helps you get started. So start with your tables and figures. A lot of the slides in this deck are just pointers. They are pointers that you should bear in mind when you're trying to write your manuscript. So I won't go through every single point. I will highlight the most important points that you need to be aware of, which is basically the most common mistakes that we see in a manuscript. So again, all of these points are there. I'll only highlight the most important points. The first one, as I was mentioning earlier, is be critical of what should be included in the manuscript. In a thesis, we have to report every single data point, every single observation. There are many, many tables in your thesis, many, many images, possibly many charts and graphs in your thesis. In a manuscript, a good recommendation is not more than 4 tables maximum. If you have 4 tables, then try not to have any charts. If you also have charts and graphs in your manuscript, then definitely the number of charts and graphs should be about 3 to 4, and the tables should be limited to 2 to 3. So you have to be very, very critical. The way we support researchers is by we tell them to identify your key message. What is the most significant finding? What is the most significant result? What is the most significant observation or new information that you want to highlight? And then based on your most significant finding, you shortlist those data points that will help you arrive at that finding. So you don't need to have long tables which are like giving ancillary information. Only those tables which directly point the reader to your most significant finding is what should be included in your manuscript. So identify your key message. All the tables and only those tables that are supporting your key message should be added into your manuscript and formatted as per the author guidelines. All those tables which are not supporting your key message, if you really want to share them, you can put them in the supplementary material. There is no limitation on how much data you put in the supplementary material. So best to just put it into the supplements. Be very, very critical and concise in what you're putting into the manuscript. The other thing, do not copy paste your tables from Excel. Always, even if it is a numerical table, start building your table from scratch in Word. So in Microsoft Word, you have the insert option on the top. Click insert. One of the options in that menu is table. Click on table, start formatting the table. You want thick lines, thin lines, you want the text to be spaced in the center or at the edge, should there be borders? Do that in Microsoft Word. If you copy paste from Excel, the quality and the formatting suffers. When you copy from Excel, the margins will be bad, text and font size will be messed up. So don't copy from Excel. Also, when you copy from Excel, sometimes the entire data file gets copied into Word, and then your manuscript will become a very heavy file. You will not be able to upload it into the Elsevier system or any system. So don't copy paste from Excel. Start building your tables from scratch in Microsoft Word. So an example is this one. This is a very common example that we share. As you can see, this author has given us a lot of text interspersed with a lot of numbers. I'm going to keep this on the screen for 30 seconds, but many of you will try to read it. What you will realize that this is very difficult to read. In a thesis, you might have put all this information in text and numerical format, but this is exactly what you should not do in a manuscript. In a manuscript, you should actually put all of this as a table. But when you're doing the table, again, this is not the best way to write a table. There are many errors in this table. First of all, why do we have this P column over here? If a column is going to have so many blanks and so many NS, I don't know what NS means, first of all. If it's going to have so much not significant, I don't know. I did not know that. Thank you, ma'am. So if you're going to have this kind of a column, you might as well not have this column. Rather, you can just put this 0.02 as a bracket over here. The second challenge, I'm not able to add up the percentages. When a reader, we as humans, as readers, when we see percentage, our automatic instinct is to try to add up the percentage to 100. Many people who have an inclination to math will also try to add up these numbers to the total number on top. But the numbers over here don't add up because I'm not able to decipher which of these is a subset of what, which one is the heading, which is the subheading, which is a subset. So it's a very messy table. Even the legend is very messy. If you see over here, the first superscript over here is C and the legend is starting from A. So my logical brain starts looking for A in all these superscripts. So even the legend is very messy. As opposed to this is a very neat and clean table. The author has actually mentioned the sample size on top, which is very easy to read. So there are two cohorts, HX and LX. Both cohorts have 43 patients. And then there are headings and subheadings. This author has actually used spacing in a very smart way to show what are the different patient categorizations. So the first category is ECOG performance. It has 3 subcategories. And here is the numbers. The numbers add up, the percentages add up. The second category is hormone receptor. It has 2 subcategories, positive and negative. The numbers add up. The third category is cancer stage. And again, you have some subheadings within that, and the numbers all add up. So in this particular table, the author has still followed the author guidelines. They've used the formatting, the size of the text, there are no column bars. The column bar is not there, only the horizontal bars are there, and the horizontal bars have been bolded. Generally, the guide for authors will have no recommendation on how to use space. So this author has used spacing in a very smart way to create a neat table. So as authors, when you take the tables in your thesis, format them as per the author guidelines, but also question, is my table legible? Is the reader able to make sense out of my table? Do I need to do some further formatting on top of what is given in the guide for authors to make my table nicer? Many institutions have very high standards of their thesis, where the thesis itself will have a very nice table like this over here. So those institutions which have a very high standard for their thesis will already have a very neat looking table. You just have to copy it back. But many institutions don't. Many institutions don't support their students in guidelines on how they should do the formatting. So if their table looks like this one, this becomes a reason for rejection. Some further points that you should be aware of: be critical of what is needed, what is the most important information you want to share. Do not use this. This is very nice for a kindergarten child's drawing. But in a manuscript, there are some rules. First of all, the first rule is that the data should mean something to the reader. This data means nothing to the reader. I cannot understand the trend over here at all. And the second rule is that most guide for authors will tell you, we do not accept colored charts and images. Most guide for authors expect that you will submit your manuscript in black and white. If you have to submit some colored images because that's a part of your research results, you have to put those colored images in the supplementary material. Whatever formatting you do, chances are that it will all have to be very simple black and white images. Use 3D graphs only if your data point is 3-dimensional. And that also can be represented by a point. It does not need to be represented by these cylindrical bars. So use a 3D point to show 3-dimensional data. If your data is 2-dimensional, use a simple 2-dimensional bar chart, not a 3-dimensional chart. It's unnecessary, it's wastage. So be mindful of these formatting issues. And as I mentioned, all of this is given in the guide for authors, including how to format your charts. So when you're starting to convert your thesis into a manuscript, this is a good place to start because it will help you overcome inertia. In many cases, you might already have very good formatted charts and tables. You just need to copy them into another Word doc to start writing your manuscript. So it helps you get started very fast. Then once you've selected which tables to add, you formatted your tables, then you can start writing your results. So in the results, again, be very sure that you identify the most important result. If your thesis has 2 to 3 important findings, it might be a good idea to break up your thesis into 2 to 3 manuscripts. Because in one manuscript, there should be one singular important finding. There can be additional minor ancillary findings, but in every manuscript, there should be one important key message. If there is more than one important key message, consider writing 2 manuscripts. That one important key message should be written in past tense. So sometimes in some institutions, even in a thesis, results are reported in present tense. Some institutions just have that as a guideline, but in a manuscript, results are always reported in the past. So if you are copy pasting, which you shouldn't, you should write from scratch. But in some cases, if you are copy pasting, be very, very certain that you change the tense. You change the tense that you're writing in your results. When you are writing your results, this is a useful website again. It's a free website. So when you're writing your thesis, you may or may not have used a framework. You may have just reported your results the way you observed them. But when you're writing a manuscript, if you have the ability to use this, use an internationally accepted standard of writing. So for example, if you had done a systematic review, you would be reporting your results in the Prisma format. Everybody knows this, right? And you even state in your manuscript that the results have been reported in Prisma format, and then you start writing your results. Similarly, there are many other formats and international standards available for other types of studies also, including for interventional studies. There are CARE guidelines, there are NTRUHS guidelines. If you are using interventional studies, you actually have many different international guidelines. If your results fit into any of these frameworks, we highly recommend that you do that and mention in your manuscript that you have used a certain framework. And again, this is a free website. You can just go to this website to learn more about these frameworks. But some of the important things to keep in mind. The results and the methods should have a 1:1 correlation. In our thesis, we will have many, many detailed steps in the methodology. And also in our thesis, we will have many, many results. As I mentioned, some theses have more than one key findings. If you just simply copy paste, chances are that you will take the finding from somewhere else and the methods from somewhere else, and there will be confusion again. So be very, very careful. For the one key findings of your results, report all the methods that have led to that finding. Make sure you report all the methods that have led to that finding. Conversely, do not report any methods that do not lead to that finding. There is a 1:1 correlation. We'll come to the Q&A towards the end. It's just easier that way. Thank you, ma'am, but sorry, we'll come to it in the end. So the results and methods should have a 1:1 correlation. Make sure that all the results are reported for the methods. I think there's some noise again.
సంజయవాణి వీళ్ళు ఉన్నారు. గీతా వందన నుంచి నేను విమ్స్ డైరెక్టర్ ఉన్నప్పుడు ఉండేది నా దగ్గర వర్క్ చేస్తుంది.
Thank you. So make sure all those results are reported, which are stated in your methods section, and you don't have any additional methodology steps that don't lead to results. I have personally come across many manuscripts which I had to reject because there were many method steps reported, but not all of them had a corresponding result. So when I see that, I can totally see that the method section has been copied from the proposal or from the thesis itself, because there are many, many steps, but not the results for all of those steps are reported in the results section. So make sure there is a correlation between the results and the methods. And you can actually do that by using this sort of like a trick. So the guide for authors will give you clear recommendations on whether you can have headings and subheadings or not. So for example, when it says results, this is a heading. So you will obviously have results, you will obviously have headings like abstract, introduction, methodology, results. But within the results, many guide for authors will tell you that you can also have subheadings like this one. We highly recommend that you break down your sections into subsections and give them these subheadings. If the guide for authors is silent on that topic, it is highly recommend that you break down your results and give it subheadings. So if you do this, then you can have similar subheadings in the methodology also. So for example, over here, in the results, section 3 is results, 3.1 patients, 3.2 efficacy. In the methodology, you can have section 2 as methodology, 2.1 patient selection, 2.2 intervention, right? So if you have this breakdown, it makes it easier for you to make sure that your results and your methodology are a 1:1 map. Some guide for authors don't allow you to say 3 results, 3.1, 3.2. So they don't allow you to have the numbering. That's fine. If the manuscript doesn't allow you to have numbering, don't keep the numbering, but at least keep the headings and the subheadings. It is helpful. And then, as I mentioned, the second and actually the most important section of your manuscript is the discussion. For a journal article, more than the introduction, it is the discussion, because it is the scientific curiosity that we are writing for. So this is the section where you should again take a lot of feedback. I know many of you have gone through many rounds of feedback when you are writing your thesis. But besides writing your thesis, when you start writing the discussion section of your manuscript, invite more feedback. This is the most important section of your manuscript. So this is where you should go beyond your supervisor. You've written your thesis based on a lot of feedback from your supervisor. But when you're writing your manuscript, invite more people, get a mentor, get other scientists or researchers who are doing research in a parallel field to give you feedback on your discussion. If you need to, you can always mention them in acknowledgements. But this is a section where you should go beyond your current research team and ask for feedback. This is also the section where you should spend maximum time. If you have devoted 10 days to write your manuscript, at least 3 to 4 days should be spent on writing the discussion section. Write it, reread it, and then rewrite it if you have to. But spend a lot of time doing this. The reason being that in the discussion section, you have the opportunity to show your thought leadership. Your most interesting finding was stated in the results section. Now, what is the interpretation of that finding? That has to come in the discussion section. So it's in the discussion section that you have all your new ideas, your opinions. Definitely all the opinions have to be in the discussion section. We don't give any opinions in the results section. So all of this comes under discussion, your thought leadership, your opinions. And here are some pointers on how you can frame your discussion section. So in the discussion section, go back to the first question of who is this research all about? Who will it impact and who will be the readers? Is it impacting patients? Is it impacting providers? Is it impacting policy? Is it impacting insurance? Is it impacting other things? For example, is there an environmental impact of my finding? Is there an impact on population health? Is there an impact on epidemiology that I need to find out, that I need to talk about? Is there a need to change any policies or regulations that we need to talk about? Those are the kind of things you should put in your discussion section. So besides this, what else can you put? We highly recommend that you invite multidisciplinary opinion into your discussion section. Nowadays, there's a lot of focus on inviting people to think about the economic impact, getting people to think about the technological impact of your findings. That's where you can invite people from other fields, or you can look at literature from beyond healthcare and reference that also in your discussion section. Now, how do you do the referencing? You might have already done this in your thesis. So this is not new to people who have already written a thesis, but I'll just highlight it again. When you're writing your discussion section, you can choose some of the literature. You can choose maybe 3 to 5 studies which are very similar to your study and compare the results. So maybe somebody did some study in Russia. Does my study agree with the results of that paper? You can comment on that. If it does agree with the study in Russia, what does that mean for my people? What does that mean for patients in India? What does that mean for doctors in India? If my results don't agree with the study in Russia, what could be the reason? Maybe there is some difference in the population. Maybe there's some difference in the environment. Maybe there's some difference in the brand that I'm using, the brand of intervention that I'm using. Maybe there's some difference there. Or in some instances, maybe the study in Russia was incorrect. Maybe my findings are more valid, or they're more valid for my population. Those are the kind of insights you can give in your discussion. And again, many of this might already be there in your thesis. You just need to frame it, shorten it, frame it, and put it again in your discussion section. In your discussion section, you will also have limitations and conclusions. Sorry, before we do that, here are some examples. So when you're referencing a study, as you can see over here, in this article, they've used this study, Ozdemir et al. Showed a significant association between NIHR clinical research activity and reduced mortality with a focus on research findings per trust. Our results are in agreement with their findings despite some variations in source data and methodology. And then they have given the implications of that for their population. So what has the author done over here? They have summarized the results of an existing study in just 2 sentences, one long sentence, in fact. So in just 2 to 3 lines, you have summarized the results and you have said that our results agree. The benefits of doing this is that it shows that your topic is not only of relevance to your institution, it is of relevance globally. If you reference a study from a different region, from a different country, or from a different part of India, it shows that your thesis topic is not relevant only for your institution. It actually has international significance or national significance. So that adds weightage to your manuscript. So it's very useful to do that. It also shows that you have done a thorough literature review and you have identified similar studies that have been done on your topic. So it's a good practice to do this. Another way of framing the discussion section is this, where you remind the reader of your research challenge. So you would have stated in the introduction what your research question is. When you're opening the discussion section, you can just paraphrase that research question to open that section again and remind the reader why you have conducted this research, and then give the answer to your research question as part of your discussion. So that's another way of framing it. What you should not do is this. Again, in our thesis, there are many, many results. There are many, many tables, many, many data points. And many times researchers are eager to share all the results. You have to be very, very selective. In this case, what the author has done is they had a lot of results, a lot of data points to share. So they have actually started stating some of those data points in the discussion section. All of these data points should actually be sitting in the results. They should either be in the results, or if these results are not relevant, they can be sitting in the supplementary material or not included at all. But your discussion should not have so many data points. Your discussion should have very little numbers and an interpretation or opinions on those numbers. So the discussion should be more qualitative. The results should be more quantitative. Sorry. Another thing that you should not do is this. So when you are referencing studies from other authors, in the previous example, the author had just summarized the entire study in one sentence. This author has written an entire paragraph on a previous study. This is not a good thing. This is plagiarism. Maybe in your thesis, you had this entire paragraph, and that's fine. But in a manuscript, you don't need to report the precise results of the previous study. You just need to give an opinion on the findings of the previous study. So in a manuscript, you just summarize previous studies in 1 to 2 sentences. In the thesis, this is fine. But in a manuscript, this needs to be much shorter. Thank you. Yeah. It's a part of the whole thing. Yeah, it's all included into one deck. So in the interest of time, I won't go through limitations and conclusions, but I'll come to the section on writing the methodology and introduction, because again, you already have your limitations and conclusions in your thesis. You can bring it forward from here. But it's the introduction and methodology where a lot of people make mistakes when they're writing them for an article. The first one is methodology. So in the methodology, again, make sure that you don't need to copy the entire methodology from your thesis. You only pick up those points which are directly relevant to your key finding. Also, in your thesis, you would have given a lot of detail on things like the manufacturers of the reagents, the expiry dates of the reagent. If you're using software, if I come to this section over here, if I come to this, the measurement instruments, the procedures, the tools and frameworks that you've used. If you've used a tool or a framework from an existing study, you would have given a lot of detail about that tool or framework in your thesis. If you have used certain software, you would have given a lot of information about that software in your thesis. In a manuscript, you don't need to give all of that. In a manuscript, you need to have just these bullet points. So if I go back even to the previous slide, everything in just one sentence. What was the sampling strategy? What was the patient inclusion or exclusion criteria? What was the recruitment process? In terms of study design, what is it, a cohort study? Is it a cross-sectional study? All of this deserves only 1 to 2 sentences in an article. So it is the same points. I've given a full list of points that you need to include in your methodology, but all of it should be just 1 to 2 sentences. If you need to include a lot of data like reagent names, put that into the supplementary material. If you need to include description of software, AI software that you have used, put that into the supplementary material. It doesn't need to be over here. And then finally, the introduction. This is where the hardest challenge comes, because in a thesis, you have a very, very long introduction chapter. In a manuscript, it's totally different. The introduction chapter should definitely be written from scratch. So when you're writing from scratch, what do you need to focus on? In the thesis, you had given all the background about the subject. Whereas in a manuscript, you only need to give the most relevant background for your research question. So based on your research question, what is the immediate information that you want to talk about? That should be included. For example, if your research question was that does using a remote monitoring device help, an SMBG device help diabetics have better long-term control on their glucose? If that's your research question, you don't need to go into the history of diabetes. You don't need to go into the current scenario in terms of the incidence and prevalence of diabetes in India. You don't need to go into the construction of an SMBG monitor, the market players who are operating SMBG monitors. You don't need to give those lengthy backgrounds. You just need to give 1.5 pages maximum on the current state of diabetes in your region, in the patient group that you have access to. Are they using a remote monitoring device or not? If they are, then what is the current process? If they are not using a remote monitoring device, then what is the current process for diabetes management? That's all. So you only focus on the most relevant information related to your research gap. Yes, you will reference other studies in your literature, but not more than 3. Limit in your thesis, you would have referenced a lot of studies in the introduction chapter. In a manuscript, not more than 3. You should reference only 3 studies in your manuscript in the introduction section. So if you complete all of this, that's when you have your complete manuscript. Once you've written your manuscript, reread your manuscript. In fact, we would advise, once you've completed your manuscript, ask a friend who is not in your research team to read your manuscript. Because sometimes we get text like this. In the effort, because when we're writing a thesis, we have to have a very long thesis. So when we have to write a very long thesis, we tend to use these long, wordy, lengthy sentences. In your manuscript, the same thing can be written in a much shorter manner. So ask somebody else to read your manuscript as a whole and give you feedback on how can you improve the language. How can you make your sentences shorter? We have a separate workshop on how can you use AI to effectively write your manuscript. It is perfectly fine to do that. We have certain recommended standards that you can adhere to. And you can use AI tools to help you improve the language of your manuscript. We can share that in a separate section. But definitely improve on the language once you have written the entire manuscript. Once you have the entire manuscript written, then we would, and you've already chosen your journal at the beginning, that's when you start compiling everything. So the journal guide for authors will have the full list of everything that you need to submit along with your manuscript. Besides the manuscript, you need to also submit your IRB certificate, any other certificates and approvals that you have sought. If you did not seek any certificates or approvals, then you still have to submit a not approval required certificate. So why did you not seek the approval in certain circumstances? Even that certificate has to be submitted. You also have to submit things like supplementary material. You may also have to submit a video summary or a graphical abstract along with your manuscript. So all of those things that need to be provided are given in the guide for authors. So you need to compile everything, and then you can go to the Elsevier author page. I think I have the link somewhere. Sorry, this is clinical key. I will add the link to the Elsevier author page. You just go to the Elsevier author page, create an account, and you can submit with Elsevier. If you need details on that process, we can have a follow-up discussion maybe for 30 minutes to understand the process for submission to Elsevier. But that's the summary. In a nutshell, if you're converting your thesis into a manuscript, key points to remember. Take a pause and question what are the most significant findings, who do they impact, and who will be my readers. Once you have narrowed down on the most significant findings, then start identifying relevant journals. Choose which journal you want to target. Once you've selected your journal, download their guide for authors. And based on the guide for authors, start writing your manuscript based on all the points that we have included in these slides. So with that, I will leave the audience with this QR code to share your feedback, and we'll open the floor to questions. So I believe there were some questions and comments in the chat. Maybe somebody can help me read the chat. There are some questions. Yeah. So I'll read it as we're also reading it. Dear Natasha, good start, and it's important to introduce research to clinical or medical community because they are sitting on the lots of samples. Of course, subjects, it's a big issue. In India, we get improper samples. It's very important to start now, at least research centers related to medical universities or colleges as foreign medical universities. Few very good points. I will try to just paraphrase some of the points mentioned in this comment. Thank you so much for putting this there. Yes, in India, we have the pleasure of being able to have lots of data around us, but that data is either sitting in silos or it is unstructured. So when we, as an institution, especially an academic institution, when we start approaching research in a structured manner, the first step is to think about how can we gather structured data. I think that's not only the responsibility of researchers, that is also the responsibility of clinicians. Clinicians have a huge role to play in gathering structured data. So if we can have institutional policies and culture on approaching research in a structured manner, approaching data in a structured manner, it can be beneficial to everybody. What is the ratio of good publication number of researchers? Do you mean the average number of research per institution?
Yes.
I think so. Yeah, I don't have the numbers off the top of my head. It changes from country to country and institution to institution. If you want to use that data to put together your institutional research strategy, we would be happy to share some sample data. I think, Durga, between you and me, we'll share some data from SciVal to give them a sense of what is the research output across the country from various institutions. So we'll add that into the slides. Another point is, maybe you are correct about predatory journals which publish between 5 to 10 days, even though PLOS, one journal, if 2 to 3.5 asking for journal, one journal in IF, 2 to 3 asking for journal acceptance, they will take more than 6 months, even after $1,000. English language correction. So let me clarify this. The journal will ask for money In fact, a lot of the high impact journals, they may have a very high APC also because they are doing very thorough peer reviews. So the journals have to pay the peer reviewers, they have to pay for maintaining the data, they have to pay for publishing the data. That is what the APC is charged for by the journal. So the journal might be charging $1,000, $2,000, but even after charging $1,000, $2,000, they are likely to take a significant amount of time, 2 to 3 months minimum, to do a good peer review. If they are asking for money and not taking that much time, that's actually a bad thing because they're taking your money and not giving enough time for peer review. So let the journal take 3 months, 6 months to do the peer reviews. Of course, the journal should also tell you when they accept your manuscript, the journal will tell you how long the peer review will take. And if they take longer than what they stated on their email, you should go back and question the journal. Yes. Elsevier doesn't. So the manuscript will not accept color images. Most journals do not accept color images. Color images should be placed in the supplementary material. Elsevier journals don't charge if you submit color images in the supplementary material. Maybe for other publishers, I cannot comment on that. That would be unethical on my part. But Elsevier doesn't charge for color images. You can place them in the supplementary material. That's a good question. As I mentioned, yes, we are aware that people are using AI tools for manuscript writing. To be very honest, that's not a bad thing. You cannot put AI as an author, but you can use AI tools for manuscript writing. There are standards and processes in place to do that. You have to include certain statements in your manuscript if you have used an AI tool. There is a detailed workshop on using AI for research. We can do that as a 45-minute session at a later date, but it's not a bad thing. You can do that. Using, yeah, correct. Many journals have also now started giving guidance on how researchers can use AI to improve the language of their manuscript, and that kind of guidance is available on Clinical Key. Oh, in the last video. We will share the QR code. Thank you. Any other questions? Feel free to unmute yourself to ask questions.
Ma'am, am I audible?
So some of the slides that I skipped were about Clinical Key. You have access to a lot of content on Clinical Key, which you can use, including some of the inputs in this workshop are coming from Clinical Key. So feel free to go back to the slides and the content.
Ma'am, am I audible?
Can you please hear me?
Any questions from the audience? I'm happy most of them have logged in from the different colleges.
Ma'am, am I audible, ma'am?
So this will be there once in a, we'll be conducting this WebEx meeting once in a month and see that you encourage, this is a beginning of it, and how to write a paper also will have separate session so that researchers, the principals and deans have to take care and see that encourage the undergraduates and postgraduates and see that it should be not only to the institution, particular medical college, you should bring the name to the university. So any questions? I think she's ready to answer. Thank you, Natasha, for excellent presentation. And this is one thing, and definitely from the university side, we thank you from all the way coming from Malaysia, and we'll be in touch with you anyhow. They're using elsewhere. Definitely, we'll make it. Any questions, sir? Dr. Sudhakar?
Sir, good afternoon, sir. Are we audible, sir? Sir, good afternoon, sir. Are we audible?
Audible.
Sir, good afternoon, sir. We from the NRA Medical College, sir. So first of all, we thank you for organizing this session, sir, which is the need of, which is not more, because last session was also on the ECMO session, which were very full. Ma'am, Natasha ma'am, thank you very much, ma'am, for giving the basic idea about this. So one small, so in your experience, so what are the mistakes that postgraduates would make while preparing these manuscripts from the thesis, ma'am? Because we have seen a lot of manuscripts for the benefit of house.
Sorry, that was one of the most common mistakes.
Yeah,
right?
whatever we have seen till now. Yes.
Like I said, the most common one is I see about the methodology.
Yes.
There is a very high tendency that people just copy the methodology directly into the manuscript without reviewing. And then what happens is that the steps in the manuscript don't match the results.
Oh,
In
yes.
my personal experience, that's the most common one.
Okay.
There is a lot of literature on this question also, and the literature shows that the most common reason for rejection is misalignment with journal aim and scope.
Okay.
Personally, I have not seen that as a very frequent reason. The most frequent reason is that the methodology and the results are not logically connected. There are too many results and I can't find the methodology, or there are many steps in the methodology, but the results have not reported anything, or they have a lot of detailed steps in the methodology, but when they actually started collecting the results, they had to eliminate many patients, they had to eliminate many data points. And you've not given enough justification that after eliminating so many data points, why is your research still relevant? So in my opinion, the most common issue I see with thesis and manuscript writing is that the methodology and the results don't look logical. They don't justify getting published in an international journal because the results are weak or the results are not holistic, are not in line with the steps which were stated in the methodology. So to me personally, that becomes the big issue.
Yes, ma'am.
I don't actually see language as a big problem. In many instances, the language is actually pretty strong, and with a little bit of correction, we just give the author some feedback, or the peer reviewers will give the author some feedback. Especially now with AI tools, language issues are becoming less of a challenge. Most people would think language, but it's not language. It is the logical consistency between methodology and results which is more concerning.
So nice, ma'am. Thank you, ma'am. Another most common question, ma'am. Is it acceptable to publish preliminary findings from a thesis before the final submission?
Generally, that doesn't work. People will tell you that you can try, but generally that doesn't work. There is a type of format called methodology. In a methodology type of an article, the purpose is that either your results are taking very long or your results are not significant, but the methodology that you have devised is very novel. So you want to share the methodology with other researchers. In my personal experience, I have done that. So I have done a lot of EMR implementation work, and EMR implementation can take 5 years. And in that 5-year journey, we get a lot of learnings in terms of technology adoption, clinician behavior, patient behavior. And we've written papers on that, which get published also sometimes. But we know the most times, if it is a 1-year research or a 2-year research, the reviewers will give you the feedback that why don't you complete the research and resubmit your manuscript so that you can also publish the results. In our case, we had a very genuine reason. Our implementation would have taken 5 years. And even before that 5 years, we had some very good findings in terms of the technology adoption and challenges. So we were able to publish. But generally for a thesis, which is a 1-year, 2-year project, the feedback will be that you complete the thesis and then publish.
Thank you, ma'am. Thank you, sir. Thank you, Radhika, ma'am.
Ma'am, I have a doubt. Am I audible, ma'am?
Yes.
Yeah. So I'm from Sibar Dental College, ma'am. I have a doubt regarding the discussion writing. Suppose in our study we have a control group and experimental group. And while writing discussion, we have to compare the present study with the earlier studies, right, ma'am? But what if our study doesn't have any supporting studies for the experimental group? How to compare our discussion, ma'am? What to write in such case?
That's not a bad thing. Don't worry. That in that case, that's a good thing. Maybe your research, your study is actually that new and novel. However, bear in mind, you would have definitely done some literature review. That literature review may not be exactly the same as your study, but there may have been similar other studies. So you can still pick up things, maybe from a parallel industry or maybe from a different specialty. So the same study has been done in a different specialty, or maybe all the work which has been done before your study. So it's not necessary that you have to pick up a study which is exactly like yours. If you do find something which is exactly like yours, that's fine. But if not, you can still pick from other industries. Another approach could be that maybe you have done a qualitative research, but somebody else has done a quantitative study on the same research question. You can compare those. Maybe you have done an interventional study and somebody else has written a systematic review. You can compare those as well. So it doesn't have to be precisely the same study. You can look at secondary alternatives also.
So in that case, can we mention a quote stating that we don't have exact studies, something like it? Because I have received comments twice. I am not sure what to write at the end, ma'am. Can we mention that?
The statement that you should use is that we are not aware of any similar studies, or we could not find any similar studies in literature review. The mistake that authors make is that they say ours is the first study in this space. Don't be so overconfident. And that doesn't add any value to the scientific community. So don't be so overconfident to say that ours is the first study. You can honestly declare that we have not found any similar studies in the Indian population, or we have not found any similar studies in our literature review. Maybe somebody else does a deeper literature review and they may find it. So be humble and transparent about it.
Yeah. Thank you very much, ma'am.
Thank you.
So I think all the questions are over right by now. If at all anything is there, you can just email to us or the Elsevier group. They will definitely give you. And as a token of respect and the cooperation the Elsevier group has given and in delivering this lecture to our affiliated colleges, I think this is definitely a useful session for all of us and mostly the PG students and also the faculty. And please stay online for a minute. So thank you, Natasha, for very crisp and very and also the same time elaborative presentation. So we thought of 1 hour, but it has gone up to 1 hour 45 minutes. And the peak participants are around 220 this today. It's really a good thing that we could see more number of participants when compared to the earlier talk. So I wish all of you will definitely utilize these meetings from the university side and to develop yourselves and the research activity in your institutions. Thank you once again, all of you, for being here. And I also thank the team of the research team from university, Dr. Sudha and Shravanti and the Rajesh for all the technical support, and myself and also our Vice Chancellor sir for being here all the 1.5 hours, sparing all his time for this talk. Thank you once again, and all of you.
Thank you. Thank you all. Next webinar, we are having a 9th of September. We are having a convocation, university convocation. I request for you all be there, and 10th I'll be there in the one webinar Dr. Siddhaya, Professor Siddhaya, MBA professor. He'll be talking about national education policy related to the health problem. That is on 10th of September. So in the future, we'll be conducting regular webinars once in a month. So today my classmate, Dr. K.V. Rao, he has come all the way from States. He's an anesthesiologist. Come. So is there, we'll utilize his services in future. Say hello to them.
I'm Dr. K.V. Rao, and I'm a proud classmate of Dr. Chandrasekhar, and I have been in the US for almost 40 years. And I'm an anesthesiologist and a pain medicine specialist, where I worked with the original research group. We developed the pain management techniques in late 1990s, which is used now. And we'll have published a textbook. We'll be releasing that under the auspices of Dr. Chandrasekhar and the university. And we'll be visiting faculty from US in November. And thanks for the opportunity, Dr. Chandrasekhar. It's a great vision and mission he is doing. Thank you.
Thank you. Thank you, one and all. Thank you, Sudhakar, and the principal RMC, Rangaraya Medical College, Kakinada, everybody. Hari Bhasha, nursing and dental, everybody. Thank you for all cooperation. Thank you, one and all.
Thank you, sir. Thank you, sir.